the general rule is that I will look for the third order bend at the front.
Sure.
And put that right. And then everything else will be marked. We did have a go with one of the wires that got it completely wrong this time, and we marked it both ways up. We marked it what looked like the right way up, and we marked it what looked like the wrong way up, and in fact they scored. So right bend adjacent to right teeth. So the trick here is, and it's usually quite difficult, is to make sure that all of the bends sit opposite all of the teeth. So if you're asked to do this one for the premolar here, and we line it up against the premolar, does the bend on the molar sit against the bend on the molar? Because on this one it doesn't really, does it? We've got all sorts of problems. We can't get this one and this one to line up together, and you can't get that one and that one to line up together. Dana? Yeah. Yeah. And so once you get the right bend against the right teeth, you've then got to check that it's clinically usable. So for instance, we have a look at the torque bend, and you have a look at the angle of the wire to the angle of the plier, and you say, well, is that a usable amount? Is it too little or is it too much? Well, that's not bad for a sort of 10
I looked at the paper and it said like torque bend by 15 degrees.
Yeah.
The 15 degrees, is that like
well, we sort of calculated that if you hold the wire in these beveled pliers and you hold the bevel on the table, then the wire, if it's parallel to the table, will have roughly 15 degrees in it.
Okay.
Somewhere 12 to 15 degrees. I mean, if you really want to check it, then you'll need a thing here to check the angle. So you have to hold the front of the wire. This sort of midpoint of the wire has to go across the middle, and then this arm of the wire has to go against the long black line, and then the angle between the handles of the pliers, you can see it's roughly about 15.
Yeah.
Yeah. So that's the amount of torque that you've got in the labial segment there. So you say 15, I mean 20 would be alright, 10 would be okay, but you put 45 in there, I think it might be a bit uncomfortable.
Too much, yeah.
So if it's reasonable, then that's okay, and you get 1 or 2 marks for that. So you can see, and then the rest of it actually fairly much the same. It's arch form, symmetry and flatness. Flatness is very difficult to do on this wire, and in fact the only way you can do flatness is to look and try and hide. If you can see that all of one side more or less hides behind all of the other side, when you look across it, then you've more or less got a flat wire.
Are you looking at the flat section of the wire, or actually the loops?
Well, the whole thing, I mean, bits of the loops will have to be below the plane of the wire, and then this tip bend has to be half below and half above. I mean, that's
how can you make it sure that it stays flat? How can you check? Can you if you put it on a table?
You can't. As soon as you've put the second order bend in,
then it's difficult.
You can't. You can before that, because you can put it upside down so that that bend comes up. But as soon as you put the tip bend in, then you have to do it by eye.
Yeah.
So I would do that one last.
Leave it till the last.
I put the third order in first.
Just thinking that actually,
Put the first orders in because they're easy to do, and then make sure it's all flat. Then put the second order in, and then just hope that it all hides behind.
Yeah. And that's by checking by the eye.
And so, arch form, symmetry and flatness. But most of your marks, most people usually get this bit right. They usually make a pretty good attempt at being able to get the bends in. Some of them are not great. And the general finding is that most people can pass reasonably well on this, and it's the removable that they struggle on. So if I go and see these couple of patients, each bit, and you're aiming to get again half mark, sort of at least 6 on these and at least 13 on these. So you can see that the thing here, you've got arrowhead position, arrowhead length and width, and bridge width, and all these different things. It's really quite hard to explain, I suppose, but what I'm looking for is things that are clinically important. Now, sometimes I mark this with Andre, and he's looking for slightly different things, because he's looking for things that look beautiful.
So he's the second examiner?
Sometimes, and then sometimes it's David Barnett, and we tend to be very sort of clinical about the whole thing. Now, I think the important bit about the arrowhead position is to make sure that they're really in undercut. And also to make sure that they're touching the teeth.
Okay.
There's no point in having them sat away from the teeth, so it's nice if they're both. Now, how you identify the undercut's quite hard, because a lot of people trim away to make some artificial undercut. But you want to have it somewhere in the corner of the tooth where you think the undercut's going to be. So it's no good putting an arrowhead here on the most labial part where it's not going to have any, you're not going to be able to activate it in under anything. And also there's no point in having it too far around the tooth, because if you activate into the embrasure, usually it opens up space between the teeth. So you don't want that either from a clinical point of view. So I'm looking for a nice bracket, and I think this wire bending was almost perfect. I mean, I think this is a really excellent piece of work, and these I think are in very good position. So that would be one thing. Now, obviously, the arrowheads in shape, they need to be nice little tight U shapes. This bit here, so it's very easy. A lot of people make them very open.
Sure.
I don't know that it makes much difference, but you need to be able to keep the wire away from the surface of the tooth, just in there. If you have them too open, when the arrowhead comes down the surface of the tooth, you want to have it so that it comes into an angle, so that it goes in underneath the bulge. If the arrowhead's too open and it comes down like that, it glides over and the tip will never go into the undercut.
I see, so you want a slight slant.
This is where this whole thing of having this bit at 45 degrees and having the arrowhead fairly tight will mean that the arrowhead tip will be able to flex over the bulge
and then go into the undercut.
Because if it doesn't do that, it won't be retentive.
Okay.
That's why I think you need to do it. That's why it needs to be nearly perfect. Because otherwise, clinically, you wouldn't be able to activate it to make it usable. And so all of these things, to be honest, they all come together, because you won't get the bridge width right if you haven't got the arrowhead position right. And you probably won't get the 45-degree bit right if you haven't got the arrowheads all tightly closed up.
So basically you get either 12 marks or 0.
Pretty well. Alright, so that... you don't want them too long, that's why we look at the length of the arrowhead, because you can get some jokers who think that an arrowhead like that...
Wow.
will be worn.
I probably should be laughing, because I'm sure mine will be the same.
Well, you can imagine if you gave that to someone, it'd be stuck in their cheek, and they wouldn't wear it.
Coming out of their nose, I think.
They wouldn't wear it, and so it's useless. So the arrowhead length is important, because it'll make it a comfortable appliance.
Okay.
And so the next thing you look at is the bridge parallel. Now this is just a sort of nicety. This is what Andre always looks at, and they need to be parallel to the occlusal surface, so that bridge needs to be parallel to the cusp tips.
Okay.
And it needs to be parallel to the line of the arch. Now that's tricky on this tooth here, which is slightly rotated, because to get this parallel to the arch, you have to make one arrowhead slightly longer than the other to keep this wire, because if you actually had it flat against the tooth, it would be at a slight angle to the arch form. So you have to be a bit flexible on that one. That just makes this a tricky tooth. And then the next thing on the list is very, very important for me, because I don't know if you've probably never bought bad retainers, but it's very easy to buy in bad retainers where the wire that goes over the occlusal surface doesn't touch the teeth and sticks right up. And of course what that does is it disrupts the occlusion. I've spent ages trying to get my teeth meet together, and then I stick a retainer in that just jacks everything open again and changes the bite, and that's no good. So this wire here really has to come across here, for me, tightly, so that you can't see any daylight underneath, and I think that's probably more important than getting the retention right.
Sure.
Because I've spent a long time with my fixed appliances and I don't want to make it worse. So that I find very important for me. And then the last thing on the list is the tag work.
Yeah.
Now the thing about tag work is that you need to have it off the plaster model, because you need the acrylic to flow in underneath the wire, but you don't want it so far away, you don't want the wire work so far away that you have a base plate that is
too thick,
5 millimeters thick. So it's a compromise. You need it far enough away to allow the acrylic, so if it touches, which some of it does, that one touches a bit, all that's going to happen is the wire work will pull out of the acrylic base, and eventually it pulls out and it's useless. So from a clinical point of view, I think all the, that and this, and actually having these in undercut and not sticking out too far, and having the flexibility to go round the bulge and into the undercut, these are all very important.
Can I just ask again, you mentioned about the slant of, is that the angulation of the tooth? You say it's rotated, that's why it has to be a little bit...
This tooth is not in the line of the arch.
Rest of them, okay.
Probably because the sevens have never been banded. So this is turned in a little bit. And so does the bridge follow the cusp tips, which is a normal thing to do? Or should it follow the line of the arch?
I see what you mean now,
which is all the way down here. Now, Andre would say it has to follow the line of the arch because that's what they do. And so it has to stick out a bit more for this one here. So that means you make this arrowhead slightly longer than this one.
Sure.
So that it turns out a little bit.
Stays that, straight
but
line.
I mean, I think it's such a nitpicking point, and I can't see that if the arrowhead is in the undercut and it's designed in such a way as to be flexible, so that it can engage the undercut once it's gone round the bulge and into the undercut, then I'm happy with it. And whether it's perfectly level, and that's why you see that in fact being level is only a couple of marks. So if it's only parallel in one direction, you're only losing 1 mark.
Okay, yeah, that makes sense.
So the more important things are to get all these things. So if you get a little bit of it right, then you'll pass.
Yeah. Okay.
And then the labial bow is... Now, obviously, this is the most difficult bit of all, because this bit, I mean, it really doesn't touch an awful lot. Now, we mark these because it's always very difficult to find out where to seat them. So we normally, if there's any doubt about how it's going to fit, then we press the wire that's passing over the contact points there down, and then we'll mark it.
Okay.
And so by doing that, we'll be able to see how many of the front teeth it's touching, and the target is 6, and it's difficult to get. I know it's difficult to do. You need this bit of wire to touch the 3, just something to touch the lateral, and obviously around the centre. It's the laterals, if they're inset a lot, can often be away from the wire. So the wire needs to be